you mind taking it out of the sling at the moment, Mrs. Watt, and we'll get a look at what you can do today?
Here in the northeast of Scotland, telemedicine's been a fact of working life for years. The technology used to be basic, but at least let doctors treat patients in remote rural locations. That technology, though, has now taken huge strides forward, and the possibilities are immense. Dr. Fiona Mayer is enthusiastic about it and says her patients are too.
They're getting their health care provided for them on their doorstep. There's no travel involved, they're being seen by a senior doctor, they have far less review, so they're not being brought back to clinics, long, busy clinics for hours on end.
Joan Brenton from the company Tandberg and John Cole from First Connections are working in partnership to help more healthcare providers exploit that technology. They say they can now bring high-definition video and crystal-clear audio into offices, surgeries and hospitals right across the country. And the NHS's new N3 network is the ideal vehicle for it.
There's a lot of bandwidth there that's available, and video is a very good user of bandwidth. So basically what you've got a network that's there with plenty of bandwidth, you've got a technology that's there that is ready, that needs bandwidth and will help deliver a good solution.
Tandberg and First Connections say health providers who had the technology years ago need to look at it again.
Think outside the box. Just don't think because we've done it like this, we've always done it, or we've had this equipment but we never used it because it wasn't any good. You probably didn't use it because you didn't know how to use it properly and nobody bothered to show you. Just think again and look at how you can improve your services.
Was there any blistering or anything? And what about the tetanus status? Have they checked that?
James Ferguson is a consultant surgeon for NHS Grampian. He uses video conferencing to share his clinical skills with patients and colleagues. In 7 years, it's managed to keep over 7,000 people out of accident and emergency at the Aberdeen Royal Infirmary. It saves money, and he says it makes him and his department more efficient.
This technology's got more robust, more routinely used. People are more accepting of it as well. In the past, there's not the same sort of ooh factor that we used to have beforehand. People are doing so many things over the TV or over the monitors that the actual thought of being treated for medicine, using this technology is more and more acceptable to people.
Professor Gordon Peterkin heads up the Scottish Centre for Telehealth. He's busy showing the benefits of telemedicine to health professionals across Scotland. It's impressive technology now, he says, but he's even more enthusiastic about its future.
This technology at the present moment is patchy. It's projects and pilots. But in the future, it's going to become embedded in what we do. This is going to be something like Skype, like MySpace. These are going to be things that are just going to be part of everybody's life.
Telehealth won't always replace face-to-face consultations with a specialist, but new video technology has the potential to hugely improve how we deliver healthcare. It means a better service for patients, better working lives for doctors, and for primary care trusts, more targets met and, crucially, more money saved.